Good afternoon, everyone. Thank you for attending the KHIE Health Summit and joining us for the next session, KHIE Solutions. Uh, all video and audio, again, has been disabled, but if you have questions, please put them in the chat box or the Q&A box, and we will answer them at the end of the session. I'd like to introduce Andrew Bledsoe, Deputy Executive Director for the Office of Health, Data, and Analytics. Kiran Maringati, Project Manager for Deloitte, and Nat Lloyden, Program Manager.
Okay, thank you, Brandon. Well, let's see. Good morning. Thank you again for attending the session. I know that there was a brief interruption in the last session. My apologies for getting kicked out, but hopefully you were able to navigate back in and finish back up with the rest of the C-suite panel. I know some of their insight and comments were just exceptional, and so it was great for me to hear. So I hope that you enjoyed their session. I'm going to move into the introduction video.
And I am the Senior Director of Provider Relations for WellCare of Kentucky. WellCare is proud to be an anniversary sponsor of the 2020 Virtual eHealth Summit. Working in tandem with KHIE and the Kentucky Regional Extension Centers, to name just a few healthcare partners, WellCare of Kentucky is a managed care plan focusing on government-sponsored healthcare like Medicaid and Medicare Advantage in Kentucky. In addition to traditional covered benefits, we include value-added benefits such as eyeglasses, an over-the-counter benefit, access to programs like Weight Watchers and Scouting. We also help get people back on their feet with assistance for criminal record expungement, GED testing, and a program called Steps to Success, which includes job coaching, interview tips, and more. We also include the most comprehensive program dedicated to solving social determinants of health through our Community Connections program. It is my great pleasure to introduce the next session, KHIE Solutions. And Health Information Exchange's role is to connect disparate electronic health record systems to facilitate quick and easy access to health information designed to improve both individual and population health in a safe and equitable manner. Andrew Bledsoe, the state Health Information Technology Coordinator and Deputy Executive Director of the Office of Health Data and Analytics, along with Anup Pant, Managing Director, Government and Public Services, Deloitte Consulting, will lend a historical perspective on the advent of the KHIE services and its
Okay, well, I guess we're going to end that one a little bit early, and we have a slight modification. Instead of Anup, we are lucky to have Kiran here with us, who has been very involved with, especially over the last 2 years as we've been migrating transition from the old platform to the new. So thank you, Kiran, for joining us today. So what we're going to start off talking about is I want to really kind of highlight 2020 in a summary. Now, it's been a strange year, no doubt, but we have continued on course and we've continued with a lot of our enhancements, system rollouts, in addition to doing a lot of additional work to support the cabinet with their COVID response. And so I'm going to talk a few minutes here kind of about what we've done in 2020 before we jump into 2021. In 2019, at the eHealth Summit in August, we were excited to debut a lot of the capabilities of the new platform. So this was launching our ePartner viewer, demonstrating our new CCDs, both a comprehensive CCD and an episodic CCD, our new event notifications platform, and then also discussing at length our data migration from the old to the new, and then what that cutover had entailed, being able to really continue to capture near 100% of the connections who were previously directed into the HIE as we've migrated them into the new. So what 2020 has brought us is a lot of enhanced functionality. And so we enabled our first FHIR API connection. We've used that for event notifications, for some other connections with participants. We're working with the Cancer Registry with an API, and also with our partners at the Kentucky Primary Care Association for CCD exchange. So a lot of exciting work. We know that FHIR APIs are really evolving in the HIT landscape right now, and we're really on the forefront of that technology and that innovation. So we're excited to be ushering that in as part of our platform here in Kentucky. Single sign-on for EHR systems. So this is a solution where you can enable your our web-based ePartner viewer inside of your EHR and single sign-on from a button that you would select in your EHR into the ePartner viewer, negating having to minimize your screen, log into our web portal, log in to the ePartner viewer, and then access the information. So it's really an ease and an additional enhancement to being able to access the clinical data that we exchange. We've launched new initiatives with the PCDH, reinvesting in the connections with our neighboring HIEs. Advanced directive, we've moved forward with being able to use that as a promoting interoperability measure and being able to display those advanced directives. Case reporting, we're going to dive into a little more deeper later. And then some additional enhancements around self-service testing to try to ease the onboarding burden and the time that it takes to be onboarded. And then additionally, we've done a lot of work around COVID. We'll talk more in depth about that in a little bit. And then some other really neat projects that we're able to do and collaborate on inside of the cabinet. Twist integration, which was a project between our office, Department for Medicaid, and Department for Community-Based Services, so that we can enable more information sharing around the foster care population. We've also released a lot of new event notifications and new ways to connect to us. A lot of work. I mean, we have been hard at work this year. 2019 enabled us to be on the new platform. 2020 brought us a lot of enhancements to that platform, a lot of additional services that we can be able to provide to you as opportunities to receive data in a meaningful manner. Then towards the end of this session, we'll actually launch into our initiatives for 2021 and beyond. Now this list looks short, but those 3 projects are huge projects that will have major implications for your organization. So we're excited to share some of the new details about that. This is the timeline. So you can see that throughout the year, even, well, really around February, March, we pivoted a huge portion of our team to be able to support public health with the COVID pandemic response. We created a whole team of people dedicated solely to the electronic laboratory reporting, and so that they could help to onboard the commercial labs and facilitate that reporting into the Department for Public Health so that they're aware of the labs electronically. For every lab that is electronically submitted through KHIE, that is a lab result that an epidemiologist or Department for Public Health or local health department does not have to manually enter into their system. So it's a major benefit for all of the labs or for anyone who are doing any COVID testing, lab testing, as well as for public health being able to receive that. So we started simultaneously throughout the year working on those COVID efforts, launching new ways to connect, new platforms, but additionally being able to maintain our timelines for implementing a lot of the new functionality that we're going to discuss. And then from a high level, this is really kind of what we as the HIE see as some of our core elements and how we were able to support the healthcare community in the state as well as the cabinet. And so we receive in the upper left-hand corner, we receive and we exchange clinical information so that we can make that available to you, leveraging a powerful master patient index provided to us by Verado so that we can ensure that we are maximizing our ability to attribute the correct information to the correct patient. We've also enabled a lot of different mechanisms to connect to us. Our goal is we want to work with as many healthcare providers and as many hospitals as possible, which means connecting to lots of EHR systems. I think at the last count, we were nearing 200 for the number of EHR systems and platforms that we were working with. So with that entails a lot of different connections, a lot of different types of ways that we communicate data. The upper right-hand corner is our work with public health and our positioning as the public health reporting authority for contributing the electronic information into public health's, both the state and the national systems for providers reporting requirements. And then ultimately our ability to provide you information. So we're collecting the clinical data, we're collecting your public health data, but making it available to you in a workflow intuitive format is one of our pillars of success, because if we're not meeting your workflow, then we're not being as successful as we can be. And that is our goal. We want to be able to provide you this information at the point of care, easing your burdens as you're providing care.
Thank you, Andrew. So thank you for this opportunity. My name is Kiran Moringanti. I'm a managing director in Deloitte. And I've been part of this transformative project over the past 2 years, and it's one of my professional career's highlights. So what we're going to talk today is about some of the key functionalities that we've built in the Kentucky Health Information Exchange over the past few years. So if you believe in the notion that data is the new oil, KHIE certainly has plenty of it. As you can see from the graphic, we receive and process over 16 million messages every month. And we are on track to process over 200 million messages in the calendar year 2020. And we get all kinds of different message types, which includes the admit, discharge, and transmission and transfer notices, syndromic surveillance, and the radiology and transcription and VXU messages, which are the immunization records that are transmitted. And we process them and we transmit them to different registries. This kind of information allows us to provide value-added services, which includes event notifications to monitor patients for hospital and emergency department admissions. As we onboard more participants, like Andrew said, we will be obviously getting a lot more information, which allows us to provide a lot more value to the clinicians that consume this information. Next slide, please. So there is a widespread adoption of the Kentucky Health Information Exchange, with 95% of all hospitals connected to KHIE, and over 1,500 clinics, providers, and points of care, and 2,600 ambulatory healthcare locations connected in Kentucky, contributing the rich amount of data, the immunization data, the encounter diagnosis information to the HIE. We have now over 1,500 plus registered users from over 200 organizations, who are now using the Kentucky Health Information Exchange and the ePartner Viewer to be able to harness some of the rich data, which is the clinical summaries, encounter and diagnosis information, summary CCDs, and Medicaid claims, and a lot more of the innovative functionality that we are adding to the Health Information Exchange as we move forward. Next slide, please. And as we see the wide adoption of the ePartner Viewer among the 200 plus organizations, we are seeing that there are the number of users and the logins that we are experiencing month on month has been a dramatic increase. And the ePartner Viewer is one of the avenues on which we can use the rich information that's collected on KHIE and make a lot of innovative uses at the points of care. So ePartner Viewer is KHIE's clinical portal. The ePartner Viewer provides a single location where the patient health information is aggregated from all the participants and presented in a very intuitive and easy to use manner. Users have the option to see the information which works best for them. Now, data that is available in the ePartner Viewer includes the patient summaries, the medication and allergies, clinical documents, lab and pathology information, results, encounters, patient demographics, and a lot more functionality that is available on the ePartner Viewer. Bottom line is there is a lot of essential health information that is at the fingertips of clinicians who are using this to provide add value at the point of care. And this portal is also mobile friendly, which means that it doesn't have to be just used on one device in one single form. It is also built on the responsive web and employs the human-centered design approaches to make the information being presented from the persona of the end user.
Thank you, Kieran. And just to kind of build on top of that, but before we go to the next slide, we just truly launched the ePartner Viewer in the March of this year, and we have exceeded our expectations for the number of participants who are using it and the number of logins. We built a lot of COVID support into that system as well, so we've seen a lot of people, a lot of pickup for using that. A lot of very interesting use cases too. This afternoon, Ann O'Hara is going to give a demo of the ePartner Viewer at 2:30. So make sure to make your way back to that demo to get more insight into what that looks like, the information that's presented, and how you can have access to that. So really, I want to talk about some of the things, we mentioned it briefly at the beginning, but I want to talk through what we've done for the COVID-19 response and some of the things that we've implemented in trying to help public health and the cabinet with responding to the pandemic. So reporting, there is a reporting requirement that any COVID test, actually I think this one's talking about reporting numbers out in aggregate format. So one of the benefits of aligning so that all of the lab tests are coming through KHIE is that we have a better opportunity to provide reports out on that information. That can be reports used internally for our purposes, reports provided to the cabinet, reports to DPH, and where appropriate and allowable, reports out to the general public on the information. So we've collaborated significantly with the analytics team, with DPH team, with the emergency management, who was working a lot with the pandemic during this year on reports that's useful to them and ways for them to access and view in aggregate manner that information. And so that was a really interesting and a new opportunity for us on our new platform that we were able to provide this year. Additionally, the lab direct data entry and onboarding. So we had opened up, what we quickly learned is the one type of connection for submitting labs to us was not going to meet all the needs for the different types of organizations who were performing COVID-19 lab test results. So we worked together to develop new mechanisms, and I think we're up to 5 or 6 different ways that you can connect to us now and send information trying to meet the needs of different technology systems and how that they can connect. One of those options is a direct entry option. And so some of the facilities aren't capturing information, the lab test results electronically. So we developed a platform as part of our ePartner Viewer where they can directly enter the information from the lab test result, and then we electronically submit that into the NEDS application that DPH and the local health departments use for collecting all of the information on the COVID reports, doing case investigations, and then providing that information to the contact tracing system. So it's, again, another way that we try to enable working with as many different facilities as possible to collect this information electronically. We leverage the data that passes through KHIE to develop an event notification and alert for COVID. I think we'll talk about that a little bit more, but this is a proactive way that we can notify you if your patient on your patient panel has had a positive COVID test result. Additionally, if you have the patient alert query functionality with us, you can receive that information for patients that maybe aren't on your panel. So the kind of high level flow of that is you have a patient in front of you, you need to know information about that patient. There's an electronic connection with us that you can electronically ask KHIE, hey, tell me what you know about that patient. And so one of the things that we can respond back to you is that they have tested positive for COVID. Provider message testing is a new opportunity to, again, try to speed up onboarding. And so this is a way that prior to developing a connection to us, you can test your messages. And that way you can know against the standards that we have to maintain and uphold for making sure the messages flow all the way through the systems that receive this information. You can upfront be able to test your HL7 data and make sure that it's matching our requirements. And then now, as we're kind of moving into this new phase with the immunization registry, we have long had a connection submitting the information into the immunization registry, but we are working with our onboarding team to support the immunization registry onboarding team and the immunization registry program. We're working to increase efficiencies and position team members to be able to help facilitate new onboarding for that submission as well. I think currently we have over 2,000 connections for organizations into the registry, but I know this pandemic is really going to push through and require us to work with new facilities as quickly as possible. So that's kind of a direction that we're not so much as pivoting to, because we're not turning away from the lab tests, but we're just focusing more attention to this now for the future.
Yeah. So when this pandemic hit us in March 2020, we worked very closely with KHIE leadership around how we can employ the health information exchange to add value to the public health reporting. So we looked at different ways we can improve the adoption of this environment, of this platform, so that we can start getting more of this information electronically. So one of the highlights is the direct lab entry that Andrew talked about. We were very closely tracking the guidance provided by the Department of Health and Human Services for lab reporting, electronic lab reporting. And we evolved that guidance and transformed it into a very intuitive functionality on the ePartner viewer, which makes it easier for labs which are smaller and don't have the capability to engage with us through the backend integration. We provided a simplified and a smart web page, which has got smart drop-downs and provides gate post questions, which ask only relevant questions based on the previous response that you provided, with the aim of both maximizing the speed at which the data is entered and also to minimize any of the typical data entry challenges that you encounter. So once this data is submitted to us, we process this in near real time and provide it to the NET system for their reporting. We've employed this particular form on the ePartner viewer is also mobile friendly. So we understand that the labs, smaller labs, can enter this information from a variety of different settings. So that's one channel that we added. And in addition, we also realized that some of the temporary labs that are being set up in Kentucky do not have the capability to send it through a web service or a VPN channel. So we quickly added another way of receiving the data through the standard secure file transmission process. And even in that, we provided multiple options of how we could provide this data in both a text format and also a HL7 format to cater to the variety of information systems that provide data to KHIE. Now, the most important thing is we've been able to, especially with the channels that we've created, able to collect a lot of this information electronically, which is the key goal here. Just through the direct lab entry process, we've got more than 10,000 plus records in a short order of time, and just from September 2020, which is phenomenal in terms of the power of what this platform can do. and how configurable this platform is to meet any of the evolving needs. And also, like Andrew mentioned, we provided a way, because the HL7 messages and in general the reporting structure, the data structures are not simple. They have to meet certain data standards and structures that we've established. And to alleviate the pain of onboarding with us and then realizing that there is a problem with the data structures, we provided a anonymous self-testing tool which any of the participants can use to be able to put the messages directly on the web form and test the messages to ensure that they meet the KHIE standards before they can ever spend time in reporting and working with us. So that dramatically cuts down on any of the downstream errors, and also it just makes wise use of everyone's time. So, one more way we are adding value to the whole testing process is we provided a very dedicated environment called the provider message testing. So your providers can directly start engaging with that environment and send some real life data. Of course, it's obfuscated, meaning it's not the real data, but it closely mimics and resembles the real life data. And they can get immediate feedback on any of the message structures, whether they meet KHIE standards or not, and then enabling them to very quickly change any of the errors and start transacting with the data. So all these are avenues and tools that we've done to make sure that we are able to very quickly increase the penetration of electronic reporting, which is the key requirement for improving and understanding the nature of this pandemic. Next slide, please. And in terms of reporting and onboarding, our key goal, like we said, was to really onboard as many new providers and laboratories as possible to capture this information electronically. Our platform is very mature, and we've been able to onboard 264 labs, which are currently sending data to KHIE, and which includes 26 commercial labs. These are reporting COVID data, and a huge backlog of 92 being in the works to onboard them. So that just shows the power of this platform and the ability to rapidly onboard and capture some of this electronic lab data. And roughly, platform has been able to process more than 1.6 million COVID tests and have routed this information from KHIE to the state reporting platform NEDS with 130,000 positives and 1.47 million negative tests. So it's been a pretty amazing year in terms of the volume of data and the volume of providers we've been able to onboard in a very short span. Now, in terms of the other important features that we have, event notifications are another important avenue for us to be able to harness this rich data that we've collected and report upon. The event notification service offers the ability to inform providers about specific healthcare events that have occurred with specific patients in their care. And it helps the treatment and improve the care coordination activities. Event notifications really allow the providers to be in the know as their patients really transition from different healthcare settings back to the practice. The use of healthcare health notifications when a patient is admitted or discharged from an emergency department to know whether a particular patient has been tested for COVID positive are very, very important data alerts or nudges that KHIE can provide automatically to the registered providers. And the other important feature that we've implemented is something called as the patient alert query service that informs the healthcare providers of their patients' known COVID status. This is a web service solution that clinicians can use to query the KHIE system to see whether any of this the patient that ended up at their facility has received any alerts in terms of COVID, and the system KHIE, because it has gathered data from so many avenues, is able to provide that information in real time. This really benefits in improved communication among healthcare organizations concerning patients, and prevents, especially in the case of COVID, helps prevent further transmission. This is powerful in terms of what the healthcare providers can know about a particular patient as the patient travels through different healthcare systems. Now, KHIE offers more than 12 different types of event notifications, and we are continually looking at adding more to really capitalize on all the valuable information that KHIE has captured across from the ecosystem. Next slide, please. So, like I mentioned early on, ePartner Viewer is the customizable health record portal that offers the real-time view of patients' records, both historical and also the latest information that's been aggregated across from multiple sources. Again, this is a mobile-friendly portal that has been built on human-centered design and responsive web design concepts to make it really render on many different platforms. Like we mentioned, the direct data entry, direct lab entry channel has really been a game changer in terms of the way we've been able to onboard a lot of these smaller laboratories and capture a lot of the valuable information that we wouldn't have otherwise captured and would have ended up being manually reported. So we've so far onboarded 276 points of care within a very short period of time, and more than 1,300 unique users using this tool on ePartner Viewer to enter the vital information every day. The information that's captured here is directly routed to the NED system for reporting and meets the Department of Public Health and also the Health and Human Services reporting standards. So it's a very standard way of collecting this information. Again, like I mentioned before, it's a very intuitive design which helps reduce some of the typical errors that you would associate with a manual data entry. By employing some of the smart concepts that are out there in the industry. Next slide, please.
This is, I wanted to talk really specifically about our electronic case reporting. This is something that I had picked on very quickly after coming into KHIE, understanding that there were a lot of implications for multiple parties if we could have electronic case reporting up and running. So to kind of explain what electronic case reporting is, so let's use COVID for an example. If you are performing a COVID lab test result, you have the lab information, the lab test that tells you a test was done on this patient, this was the result. That's simply to notify that a test had occurred and the basic information. A case report must be filled out for every positive COVID result. This is not just specific to COVID, but this is for any communicable disease reporting requirements per state regulation. But COVID's a good example. So you have the positive lab test result. You've already submitted that to your local health department or Department for Public Health, told them about it. But then you're required to send that case report. What we have developed is a technology that will electronically transmit that information. It is also automatically generated outside of your EHR system. So the way that it typically works is there is a trigger event that would occur in your EHR. and that can be a positive diagnosis of COVID, a positive lab test value, or a few other things. When your EHR sees that trigger, it knows on the backside, hey, I need to develop an electronic case report and send that to the health department. So it wraps up all of that information in a CDA, which is kind of a technical term, but it wraps it up in a specific summary of care to case reporting, and then electronically sends that out, sends it through KHIE. We capture a copy of it. We then send it on to the Association of Public Health Laboratories AIMS platform, which houses a clinical decision support tool. This is a national platform that we're sending it to. They analyze the case report based upon specific parameters that Kentucky has input that for case reports that they want to receive. So when we send it into their platform, it will analyze it and say, nope, Kentucky, this does not qualify for them. Maybe it's missing some information. Maybe it needs additional information, or maybe it's just not something that they want to receive. So then it sends it back through KHIE into your EHR system and tells you it was not reportable. If we see that not reportable, we do not store that information in KHIE, we remove that. But it gives you the opportunity to either input the additional information that you may need, or to know that that's not a case that needs to be submitted to public health. So then, if it is a reportable condition, we store it in KHIE, and we, as part of some additional functionality next year, will make it viewable in our system, because we've learned other facilities other than the state are doing contact tracing, and it's of benefit and of value to them. We've also received approval from DPH to do that. And then that APHL, if it's a reportable condition from their platform, they send it directly into the state's NEDS system. That makes it available to both the state Department for Public Health and your local health department, whom you are currently manually submitting those forms to. So we are automating the system so that you are no longer having to fill out that EPED 200 or the PUI form and fax or submit that to your local health department. And we're still able to provide it to the organizations that need it. We can additionally do this. The APHL platform works with multiple states. So if you're on the border and you are able to send us that case report, we send it to APHL, and they see that it should actually go to Indiana, they can send it into Indiana. Now, this is a fairly new program that is facilitated by the CDC and the APHL. The COVID has significantly expelled the speed that this is being implemented across the states. Currently, the only EHR system that we're able to work with for this is Epic, but I know that the CDC is working quickly to develop multiple other capabilities for connecting to other EHR systems. As they roll that out, we're working collaboratively with them to be able to utilize that technology and work with other EHR systems as well. And then so something as a future enhancement we're working on to roll out early next year is a direct data entry option. So if you are directly entering that COVID test result into KHIE and it identifies that it's positive, you can automatically enter in the case investigation information as well, so that you're not having to manually fill out the form. You can all do it in one spot. So again, this is something that I love highlighting, because I really took it on when I came into KHIE, seeing the opportunities here and the value and the benefit for both the clinical organizations and public health. So I'm excited that we've been able this year to really move that forward. Some additional services that we had talked about last year, but have moved forward with and implemented additional enhancements to. One of those is the patient-centered data home. So this allows us the opportunity to send ADTs and CCDs, or a summary of care document, to our neighboring states. The patient-centered data home is a national project that's facilitated through the Strategic Health Information Exchange Collaborative, and is done on a regional basis. And its ultimate goal is to facilitate national exchange of information. We just do it in a regional model, and then the regions connect with the other regions. We're in the Heartland region, and we provide this information to Indiana, Ohio, Michigan, West Virginia, Tennessee, and a few other non-contiguous states as well. And so enhancements we've made this year have allowed us to be able to send that ADT and that CCD to those states and allow us to receive that information as well. We've already talked about kind of the increase in the NEDS reporting. So we've done a lot this year for the COVID specific, but connecting to all of these commercial labs will allow us to expand on other communicable diseases that they collect, as well as healthcare organizations. And we can send that electronically to DPH, further reducing the amount of manual work that your infection prevention individuals are likely having to manually report currently. This is SFTP is a new functionality that, and one of the ways that we're connecting with other healthcare organizations like the commercial labs who maybe don't have an EHR system, but they still want to be able to provide us data. So previously, everything was a strict electronic direct live feed. We've now enabled connections through an SFTP site so that we can consume information in non-standard format, which allows us to make our data set more comprehensive. Single sign-on, we talked a little bit about earlier. This is a really unique and incredible functionality wherein you can embed a link to our ePartner viewer inside of your EHR. And we take your credentials and we automatically send that through so that when you click on the ePartner viewer link, it will launch the application inside of your EHR system and automatically log you into the platform so you can begin searching and working with your patients very quickly. It's a workflow intuitive way that we are moving towards in getting that ePartner viewer embedded into your current workflow. And a few of our other public health programs that we're working with, the Extreme Drug Resistant Organism Registry. So we are capturing XDRO or positive CRE diagnoses that are submitted through us. And we are providing that to the registry for them to evaluate and to populate into the registry when appropriate. But we are also making that available back to you. What this would tell you is that you may need to use specific precautions with a patient that would have this type of an infection. Maybe you would want to use a gown instead of only gloves, but as clinicians, there's valuable information in knowing this about a patient up front. So we present this in our ePartner viewer. We also present this through our patient alert query. Additionally, we have talked about the immunization registry where we are contributing information into the registry. We also have a query connection where we can send historical immunizations on a patient directly back into your EHR system as well. Again, meeting that workflow.
Okay. And we are supporting as many channels as possible for us to be able to receive information electronically. So direct secure messaging is another channel through which we are able to exchange and receive information. So at its core, it's a simple and a secure way for providers to send authenticated and encrypted PHI information or personal health information to known and trusted recipients over a secured and encrypted network. Now, providers can utilize the health information exchange provider, KHIE, to improve the care coordination between themselves by leveraging the KHIE. KHIE is actually used now has the capability and is leveraging this channel to exchange electronic case reports that Andrew talked about, the cancer registry data, advanced directives, event notifications, and CDA documents. So we are employing this channel as another tool in our arsenal to ensure that there is definitely always a way around to exchange information electronically and never have to resort to manual methods of transmitting information. So we've transmitted, this has been in use and it's widely used, and it's being used to transmit over 40,000 plus direct secure messages a month. So it's a good channel that we have that the participants can leverage. The other functionality that we have implemented recently is something called as advanced directives. At a conceptual level, advanced directives enable a person to register his or her treatment decisions in advance and document specific instructions regarding potential treatment so that in case of when they become incapacitated, the caregivers can use this information. KHIE has the capability to receive this advanced directive CDAs from its participants, both over the ITI 41 transactions and also the DSM route, the direct secure messaging route. And once we receive this information, KHIE's ePartner viewer displays this information. So if any of the participants want to see this advanced directive, they can view it in the one-stop shop ePartner viewer. Early on, we talked about the FHIRE protocol. We're very excited about bringing this new protocol, which is going to be the most predominant way of how data is exchanged in the industry. FHIRE, for folks who don't know what it is, it's a fast healthcare interoperability resource protocol. It's made for mobile devices. It's very lightweight in the way it enables the exchange of information. So we've implemented this protocol to be able to receive the cancer registry reportable CDAs that we capture from providers, and we have the ability to send it to the cancer registry. We are continuing to collaborate with the cancer registry on how we can exchange this information. So we are very excited about this capability as well.
New things that we have enabled with our ePartner viewer is the ability to export summary of care documents. So if you are inside of the ePartner viewer and you find some information that you want to be able to share with yourself, maybe you want to send it into your EHR system, or if you want to send it to another facility, you can simply click on the little icon there, the envelope with the lock, and it brings up a screen that will allow you to send that CCD. We have implemented this as a use case for some of the promoting interoperability measures where you are needing to collect information inside of your EHR on patient transitions. You can log into the ePartner viewer, query for your patient, and then send this to yourself. And so there's a couple different use cases here, a couple different formats, but it's again trying to provide the data in multiple avenues that are workflow intuitive. As part of some of the additional enhancements inside the ePartner viewer that we saw this year, we added the date selection. So this will allow you to choose how you would want to query the information. Maybe you're working with a patient and you only want to receive the most recent 3 months, or maybe that this is a patient that you need to know a specific lab test that was logged with them 3 years ago. And so you can customize that date range so that you can search for the information that maybe the patient's telling you would be available for them, or something that you know that should be available to you for them. And so again, multiple functionalities to try to help to increase the data that you can see inside of the system. We have added a lot of event notifications this year. I think last year when we kicked this off, the event notifications was hospital admit, discharge, and emergency department admit, discharge. This list over here is the additional ones that we've added. So if there was a specialty encounter, results, lab results ready for review, behavioral health admit or discharge, positive toxicology screen received, emergency visit overutilization, which is more than 4 times in a 365-day rolling period, and then a possible COVID-19 positive. So if we receive a positive lab test result on a patient, one of your patients that you've elected to receive event notifications on, we can proactively tell you that in a manner that you would elect to receive it. Now we're going to talk through, so that's kind of where we've been this year, new services that we're implementing, things that we've worked on. And so let's kind of roll into future projects and emerging topics. We're going to start with our image exchange. I am very excited for multiple reasons, but maybe because it took me 2 years to get the funding approved for this. But we are able to launch, we received approval in October to launch into our imaging exchange. Prior to now, we were only exchanging transcribed findings from a red image in the HIE. What this will allow us to do is exchange actual images from the PACS systems and between PACS systems. So we will actually connect to PACS systems and make images available inside of our ePartner viewer. So if you are, if your patient is telling you that they just had some type of an x-ray done at a hospital, rather than having to call up the facility and ask them to send that to you, it's readily available to you inside the ePartner viewer. If you are a hospital, we're also working to connect PACS to PACS so that we can deliver the information directly into a PACS platform that is meeting the DICOM standards for radiologic diagnostic images quality. And so we're on a quick implementation timeline for that. We're currently completing requirements and design sessions internally, and we hope to be connecting with participants mid-January and starting to collect and work with as many participants as possible, building up the network of images that will be made available to you inside of our platform. I don't know if Kieran, if I covered that or if there was anything else there.
No, Andrew, you covered it. A couple of things from the back-end technical perspective. This is going to be a game changer in terms of being able to display clinical information and the radiology information side by side. We are behind the scenes. We will be providing a couple of methods of exchanging this image information. One is the DICOM protocol, which stands for the Digital Imaging and Communications in Medicine, which is the de facto standard of how the information, medical imaging information is exchanged. And also something called as the KHIE will be supporting that protocol as well, which is the cross-community access for imaging. It just provides multiple ways. Again, our theme of being very inclusive in the way we are accommodating multiple technology systems to interoperability with KHIE. So we are in the testing stages, and we will be rolling it out in early March, and we'll be working with each one of you. So very, very excited about that piece of functionality that's coming in.
Well, hey, good morning. I guess right before it turns into afternoon. My name is Nat Loudon, and I'm a new program coordinator at the Kentucky Health Information Exchange. It'll be my pleasure to detail our work on social determinants of health. And this is a good overview slide here. We're going to detail kind of how we receive SDOH data and understand that data. So we get all kinds of data, as we've mentioned in previous panels here, all types of coding, including ICD-10 codes, LOINC codes. So how can we pull the social determinants out of that and make it in kind of a standardized way? How do we display that data in a meaningful and intuitive way for providers and community stakeholders to actually use the data? And then how do we send it so that everyone in the community and every stakeholder involved can actually use the data? So here's a visual and just a brief introduction of what social determinants of health are. Now this is the statistics pulled from the county health rankings model that I'm sure a lot of you are familiar with if you've been involved in social determinants of health. And it really highlights that only 20% of our health is coming from clinical care. That's access to care and quality of care there. So as we move as a healthcare industry from fee-for-service to a value-based care, a greater emphasis is placed on population health. And we think that by making this social determinant of health data available, It'll give providers a better tool to control and hopefully improve health outcomes in the state of Kentucky. Next one. Thank you. So this is a macro view of what we're doing here. So Deloitte has been gracious enough to build us almost a filter where we can receive all kinds of data and then populate that and standardize that to what the Kentucky Resource Engine has done. Now, the Kentucky Resource Engine has created, I believe, 13 domains, and they base that off of the Arizona Self-Sufficiency Matrix that puts social determinants of health into kind of 3 categories: critical, important, and stable. So what KHIE and Deloitte will do here is when we receive the ICD-10 Z codes, LOINC codes, and data from the resource engine, we will filter that through and kind of standardize that so that it falls into each of these categories. And the providers and community stakeholders, again, can actually do something with the data. So our intent here is to kind of standardize the data a little bit so that it makes sense to everybody when we send it to them. Now we've got ICD-10 Z codes listed here and the 80216-5 LOINC codes, but we also hope to add other assessment tools like the Prepare tool and the NOM set. So we will be working on this and using this to kind of help fuel our social determinant of health work in the future. And go to the next one. And the next view here will be more of a micro view. So in this scenario, we're looking at the resource engine domain of housing. So a person can get an ICD-10 Z code of Z59 homelessness, and that will filter through our KHIE filter here. And we will put that in the critical domain so that stakeholders and providers understand that that is something that should be addressed and hopefully connect them to the proper resources. And the same thing with, you can see there is Z59.1, inadequate housing. Inadequate housing isn't the same or isn't as severe as homelessness. So that one gets kind of standardized into an important category. And then on the right side, we have our LOINC code that is more of a generic, but we can take the answer there. And if they answer not very hard, we can put that into the stable category. So providers and community stakeholders know that patient is pretty good there. Now, once we've collected the data, we will show it in our ePartner Reviewer here. And this is just kind of a mock-up of what we would show. And you can see on that right side, we'll have our own social determinants of health portlet that allows providers the opportunity to see what their patients are going through at the moment, and hopefully allows them to connect to community resources to mitigate those effects. Now, we put it here in the ePartner Viewer so that providers wouldn't have to go outside of the ePartner Viewer, lessen kind of the clicks that it takes to get there, and reduces the burden. Now, once you click on the portlet, you'll have a kind of a more detailed view here. And you can see on that right side, those are the social determinant of health domains that the Kentucky Resource Engine has created. So we will have all of our coding and SDH data flow into those domains, kind of how we showed in that micro view slide. And this is where it will populate so that providers and community stakeholders can see it. Now, this is particularly prudent in today's time, as we have a ton of research that's coming out that shows the added impact that COVID-19 has on social determinants of health and the disparities that are showed between certain groups. So we hope that our facilitating the transfer of this data will help mitigate the negative impacts that come from social determinants of health and then are exacerbated by the COVID-19 pandemic.
Thank you, Nat. And yeah, just to kind of wrap that up, we're fortunate. This is another one of those opportunities where, because we're located inside of the cabinet, we're able to collaborate very easily with other agencies. And so this is a unique opportunity that we're able to present and provide to Kentucky that other states or other HIEs aren't able to partner so easily on. And so we're grateful to the team who have developed and are working with the Kentucky Resources, which is now known as Connect Resources, and being able to collaborate and make this something that we can really impact patients' lives with. Just to kind of wrap us up, the last one that I wanted to talk about is the CMS event notifications. As part of the interoperability rules and patient access rules that came out this year, and if you're a hospital, your CMS conditions of participation, you are being required to send event notifications or ADT information to a provider of the patient's choice. So if a patient is being admitted into an emergency department or a hospital, and they say to you that they want their information to go to Dr. John Smith, you as a healthcare facility, as a hospital, are required to send that patient's information to Dr. John Smith. The good news is we have built a service that we can help facilitate that for you. Additionally, as a hospital, we are receiving likely already your ADTs. We are live receiving ADTs from 95% of the hospitals from around the state. So a majority of the work is already done for you. All we're going to have to do to allow you to meet this requirement is you need to map certain data items and elements into the HL7 message. And really, quite simply, all we're looking for is the provider's name and NPI number that patient has told you they want that information to be sent to. Now, there's a couple additional layers on top of that. If you send us more information, we can send it multiple ways. But this is ultimately a system that can easily allow you to meet your CMS conditions of participations and requirements. This is the first time really that we're talking about this. We are trying to implement this very quickly, and we will be making sure that this is implemented in a manner that is allowing you to meet your timelines as a hospital for those conditions of participation. So as we turn into the new year, you're going to start to hear more and more about this, and you're going to start to see more and more about this from our team and from our outreach coordinators. So this is really kind of putting the bug in your ear that this is something we're going to start talking about, and we will be contacting you with some follow-up information and more specifics on how your organization can benefit from this.
Yep. So in conclusion, again, we're very proud of what Deloitte and KHIE working together have been able to accomplish for the citizens of the Commonwealth. My special thanks to Robert and Andrew for their leadership. It's, I mean, when we talk to our counterparts in other states in Deloitte, I mean, Kentucky is so far ahead in terms of being the national leader in the health information exchange space. And certainly we are going to be working as hard as possible to create a platform and sustain it and make something that is everybody can trust it and be proud of it. And of course, you've seen a preview of all the projects and the technology. As a technologist, I'm super excited and really thank you for this opportunity.
Thank you, Kieran. I appreciate it. And I second the sentiments. It's great to have a good partnership between our organizations because we're both really working towards the same goal of increasing the care for patients as the ultimate goal. And being able to facilitate this exchange and all of these different services that we're providing are just ways that we can help to contribute to the success of the healthcare organizations in Kentucky. So I appreciate the partnership and the technology and the consultation that Deloitte is able to provide us to help us to do that. So this morning in this session, we talked about really high level things we're doing, things we've implemented this year, what's coming next year. This afternoon, we'll follow 4 sessions going into deeper detail some of the services that we provide that are beneficial to you. So we're going to talk about public health reporting from 1 to 1:30 and hear from Dr. Bensema about how public health leverages health information technology to support them. During the integrative premier services, we're going to talk more about the Platinum Connection. We're going to hear from national leaders on how exchanging CCDs and sending them directly into an EHR system can benefit and impact your workflow. From 2 to 2:30, we're going to talk about the different types of event notification systems and event notifications that we provide and hear from a couple of facilities who are currently using that, and they can share their story for how they found benefit in those event notifications. And then to close out the day, we're going to do a demo of our ePartner Viewer and hear from some of the participants who are using that service and how it's benefited them. So I know we're a few minutes over, but at this time, please make your way to the exhibit hall, talk with our exhibitors, check out our vendor huddles, and talk with some other organizations who are using the same EHR system as you. It's a good time to ask questions of our technical team members, talk with other organizations, and grab some lunch and be back by 1 o'clock. Thank you.
Thank you.